So the second part of this lecture really focuses on breathing. So the physiology of breathing, the mechanics of breathing, how is respiration happening? And so when we talk about breathing, we're going to really focus on it from two aspects. There's really two phases to pulmonary ventilation. Inspiration, which is breathing in, right? It starts with in, so breathing in. This is bringing air into our lungs. Inspiration is an active process. What does that mean? What's it mean when we say it's an active process? What does it require? It requires muscle contraction and energy, ATP. So when you breathe in, you're right, it's requiring muscle contraction and it's requiring energy. It's an active process. Expiration is blowing out. So gases are exiting the lungs during expiration. This is a passive process. That means no energy is needed when you blow out. So when you take a big breath in, you're using a lot of energy. And when you passively blow out, you're using no energy. All your muscles are just relaxing. So let's talk a little bit about breathing in and out. How this happens has to do with pressure, and pressure changes. How you are able to pull air into your lungs and how you are able to blow air out of your lungs has to do with pressure changes. And so truly what's happening is air is moving from areas of high pressure to areas of low pressure. High to low. This is basically diffusion, right? We're moving from high to low, high pressure to low pressure. So we are going to move gases in that direction always, okay? So what's going to happen is when you breathe in, the air is going to move into your lungs. When the pressure in your lungs is less than the pressure outside of your lungs in the atmosphere, okay? So when the pressure out in this atmosphere is high and the pressure in your lungs is low, the air is going to move from high out here to low in your lungs, okay? High to low. When you blow out, air is going to move out of your lungs when the pressure in your lungs is higher than the pressure in the atmosphere, pressure outside the lungs. Again, we're always going to take air from a high pressure to a low pressure. Is atmospheric pressure changing? Not unless you're scuba diving, okay? It's not changing. Not unless you're on an airplane that doesn't have a pressurized cabin. The atmospheric pressure is not changing. So what pressure is changing? Pressure in the lungs is what's changing. You are either increasing the pressure on your lungs or decreasing the pressure on the lungs. And that is going to drive respiration. It's either higher than atmosphere. When it's higher than what's in the atmosphere, it goes out of your body. You blow out. Or it's lower than atmosphere. And when it's lower than atmosphere, you breathe in. Okay. So there's really three pressures that will play a role in breathing. Atmospheric pressure, which I've mentioned a little bit. We'll talk more about this. This is the pressure exerted by the air surrounding your body. So it's what's in the atmosphere. Intrapulmonary pressure. Intra means within. Pulmonary means lung. Okay, so intrapulmonary pressure is the pressure in your lungs. Now, on the last slide, this is basically the only two I talked about, atmosphere and pressure in the lungs. There is one other pressure that's important here, and it is the intrapleural pressure. Again, intra means within. Pleura is the cavity. It's the space. It's that pleural cavity. So let's go back to a picture to remind you what that cavity is. It is this space that we find in here between those serous membranes. That's the intrapleural pressure, okay, in that pleural cavity. All right, so let's walk through all of those. We're going to talk about all three of those pressures. So we'll start with atmospheric pressure. A lot of times, if you're reading your textbook, they'll abbreviate it as PATM for atmosphere. This is the pressure that is exerted by the air surrounding your body. Atmospheric pressure at sea level, and we are close to sea level, is 760 millimeters of mercury. We typically call that 1 atmosphere. Okay. And so we always describe our respiratory pressures in relationship to atmospheric pressure. So what we say is a negative respiratory pressure means that it's less than atmosphere. That's all that means. A positive respiratory pressure means it's greater than atmosphere. It's above atmosphere. And a 0 respiratory pressure means it's equal to atmosphere. Okay. So let's start back here. A negative respiratory pressure, I told you that just means it's under atmosphere, it's less than atmosphere. This would be an example of how it would be described. If atmospheric pressure is 760 millimeters of mercury, a negative respiratory pressure, like a pressure that's -4 millimeters of mercury, that means it's 4 under atmosphere. So it means it's 756 millimeters of mercury. Okay, that is 4 less than 760. A respiratory pressure that's positive means it's greater than atmosphere. So one that's +4 would be 4 above atmosphere. So it would be 764. And a 0 respiratory pressure means it's equal to atmosphere. So essentially it's 760. Okay. So we always relate respiratory pressures to atmospheric pressure. It's either above, below, or the same. Right. Yes. So does anybody scuba dive in here? So I used to scuba dive when I was younger with my dad, but I have a lot of ear problems. And one of the things that I have a hard time with is when I descend under the water, the atmospheric pressure gets so much greater, and it gets greater really fast because of the pressure of the water on top of you as well. And so it really hurts my ears. You can feel that extra pressure on top of you, especially in your ears. So yeah, when you go below sea level, the pressure is getting greater. And when you go higher up in altitude, the pressure is getting less. It's getting less pressure. Yeah. Yeah, the humidity doesn't really have to do with the pressure. It just has to do with the water that's in the air. Yeah. Yeah. Yes, absolutely. So when you scuba dive, when you are coming up from underwater, you have to come up very slowly, and then you have to do what they call a decompression stop. And a decompression stop is where you just sit at a certain depth in the water, and you just have to wait there for a little while, and you have to let all of that extra gas that might be in your body, you have to let it off gas, because if you come up too fast, what's going to happen is that gas it has to come out, and it comes out in bubbles in your body, gets stuck in your joints, it gets stuck in your brain. You can die from that. So yes, that's why you have to come up very slowly. And it really depends on how deep you dive. The deeper you go, the slower you're going to have to come up. So we also have, other than atmospheric pressure, we have that intrapulmonary pressure. So again, remember, pulmonary means lungs. So this is the pressure in your lungs, in your alveoli. This is what's changing for you. You are changing the pressure in your lungs. Okay, so this is the one that's going to fluctuate with your breathing. Atmospheric pressure is not typically changing for you. It's intrapulmonary pressure that changes. And I'm going to come back to this right here. It always eventually equalizes with what's in the atmosphere. It'll make sense as we keep talking about these pressures. So I'll come back to that. The other kind of pressure is intrapleural pressure. And this is the pressure that's in that cavity. It's in that space. This one also fluctuates with breathing, but it is always negative. The pressure in your pleural cavity is always negative because that negative pressure creates a suction that holds your lungs open and it prevents your lungs from collapsing. So this one's going to fluctuate with breathing, but it's always going to be less than what's in your lungs. Okay, it's always going to be less than your intrapulmonary pressure. So I want to talk to you a little bit now that we know those different kinds of pressures. Let's talk a little bit about what is happening when you're breathing. When you breathe in, remember, air is going to go from where you have a higher pressure to where you have a lower pressure. Okay. So when you breathe in, it's an active process. Your diaphragm is a muscle. You contract your diaphragm. And when your diaphragm contracts, it goes from being looking like this, kind of bubbled up, to contracting and getting flatter, kind of moves down. Okay, so when you breathe in, diaphragm contracts, kind of pushes down. The muscles between your ribs contract and your ribs pivot up. So the space where your lungs are sitting, that pleural space in there gets bigger, okay? And the pressure goes down. There's nothing pushing on your lungs. So the pressure in your lungs goes down. So this is how you're breathing in. Pressure in here goes down when the diaphragm contracts and the space in there gets bigger. And the air is going to move from the atmosphere where the pressure is higher to in your lungs where it's lower. Okay, so that's breathing in. When you breathe out, your diaphragm is going to relax. And when it relaxes, it bubbles up. This is going to start to push on your lungs. And it's going to increase the pressure. Pressure is now going to get higher in the lungs than it is in the atmosphere, and you're going to blow out. Okay, breathe in again. That diaphragm is going to contract and push down. The space gets bigger. The pressure goes down. Air goes from high to low pressure. When you blow out, diaphragm relaxes and bubbles up, pushes on all this. The pressure in here gets higher. You blow the air out, high to low. Okay, this is breathing in and out. It's just pressure changes. Now, I want you to just sit and kind of pay attention to your breathing. Okay, in and out. I want you to focus on that really short period of time between an inhale and an exhale. That time where you're not really breathing in, you're not breathing out yet. That point right there. That is when the pressure is equal. That's when the pressure inside your lungs and the pressure in the atmosphere is the same. Okay, same thing when you blow out, right before you start breathing in again, that pause, pressure is equal. So if I go back, remember I told you I would bring this back up again. Eventually, the pressure in your lungs will always equal what's in the atmosphere. Right before you start breathing in again, or right before you start blowing out again. It always will equalize. Okay, so it gets negative, then it equalizes. Then it gets positive, then it equalizes. Okay. So here's our pressures up here. So we have our intrapulmonary pressure, interpleural pressure is equal to our pulmonary or our atmospheric pressure, then the lungs will collapse. So this is the pressure in that cavity. I told you that your intrapleural pressure always has to be negative to what's in your lungs or negative to what's in the atmosphere. If it ever equals what's in your lungs or equals the atmosphere, your lungs will collapse. So there's always a difference between your lungs and the cavity that they're sitting in. And we call that the transpulmonary pressure. This is going to help to keep your airway open. This is a negative pressure in that cavity that's holding the lungs open. the larger that transpulmonary pressure is, the more negative that pressure in the cavity is, the more suction you have holding your lungs open, and the larger your lungs will be. So if we look at a picture here, this is showing you those different pressures. So we can see our intrapulmonary pressure. That's the pressure inside the lungs. We can see our intrapleural pressure. This is the one that is always negative. Okay, so in the cavity, I'm standing too close to the board. It doesn't like that. There we go. It's always negative. If what's in that cavity ever equals what's in the lungs or ever equals what's in atmosphere, your lungs will collapse. Yeah. Just a general number. Yeah. So it's constantly changing. This is just an example. Now, there is a condition called a pneumothorax. This is when someone gets air in the pleural cavity. Usually this is from a wound, maybe a gunshot wound, a piercing wound. If there is a wound coming from the outside into that cavity, now the pressure that is in that cavity is going to be equal to atmosphere, and you have lost your suction, right? And the lung will collapse. This is typically treated by removing the extra air that has gotten in. They'll put in chest tubes to help reinflate the lungs. I'm sure they are. I'm sure they are. Now for inspiration and expiration, we're going to talk a lot more about these. All I've done is just introduce you to the pressure terms, okay? Inspiring and expiring, this is a mechanical process. And it truly depends not only on pressure changes, but volume changes in that thoracic cavity. I've alluded to this already in talking about that diaphragm, just to kind of give you an intro into this. When you change the volume, you change the pressure. And when you change the pressure, that's when you can move gas. And again, the pressure you're changing is the pressure in your lungs. You're either pushing on your lungs or you're expanding everything and dropping the pressure. So by changing pressure, by changing volume, that's how we change the pressure. So this is actually Boyles Law. Boyles Law is the relationship between pressure and volume. And so I have some little things that y'all can look at if you want to. I'll pass it around. Don't really need that. Y'all can pass that one around. So it's basically just a syringe, okay? And I'm gonna fill this syringe up with air. There's nothing in here, it's just air. And then I'm gonna put a little cap on the tip of that syringe. So now it's in a closed chamber, okay? So what Boyles Law says is that the gas is filling this chamber, okay? And if you try to reduce the size of this container, it's still the same amount of gas. And what you're now doing when you reduce the size is you're pushing on that gas and you're increasing the pressure. So what you'll do, I'll pass one around, but basically what that means is if I take this syringe that's now closed and I push on the plunger, I'm reducing the size in here, right? And the pressure is going up. Okay, same amount of gas in here. I've just compressed it and made it smaller. And now the pressure in here is high. I'm keeping my finger on this tip because I've done it so hard before where the tip of this flies off because the pressure gets so high in here. Okay, that's Boyles Law. It basically just says fill a container with gas and then reduce the size of that container and the pressure is going to increase. So we say that pressure varies inversely. Okay, this is a math term. Inversely means opposite directions. With volume. Pressure varies inversely with volume. So what that means is if you increase the volume, then that is going to decrease the pressure. Or if you decrease the volume, that will increase, oh man, the pressure. They vary inversely with each other. So again, if we look at this, if I decrease the volume, I am increasing the pressure. If I pull this plunger back out and I increase the volume, pressure's going down. Okay, so they just are opposites. They vary inversely with each other. And so you have the images here also. This is showing you high pressure, and this one down here is showing you a low pressure. And it's showing you how they are varying with the volume. You squeeze on this, you decrease the volume, pressure goes up. You pull that plunger back and you increase the volume, pressure goes down. They're just opposites. So how does Boyles Law relate to inspiration? So a couple things we've talked about with inspiration is I told you that it is an active process, meaning that it requires energy. It requires ATP. And in order for you to breathe in, to inspire, all of your respiratory muscles have to contract. So what are your respiratory muscles? They're going to include your diaphragm, which is that thin-walled muscle between the thoracic cavity and the abdominal pelvic cavity. That's going to contract, and as it contracts, it actually kind of pushes down. So it increases the volume in the thoracic cavity, okay? And your external intercostals, these are all the muscles between your ribs. They're going to contract, and your ribs are going to pivot up a little bit. Again, increasing the volume in the thoracic cavity. So volume's going to go up. When volume goes up, what happens to pressure? It goes down. They are inversely proportional to each other. So when the volume up here starts to go up, the pressure goes down, and the pressure drops below what's in the atmosphere. And remember, we always relate that intrapulmonary pressure to atmospheric pressure. And if it's lower than atmospheric pressure, it's written as a negative number. So it's written as -1 in this example. And remember, air is going to go from a higher pressure to a lower pressure. So it would move from out in the atmosphere into your lungs where the pressure is lower, high to low pressure. Okay, so it's going to move down a pressure gradient until the pressure is equal, until what's in the lungs and what's in the atmosphere equals out. Okay, so now let's look at a forced inspiration and talk about how that's a little different. So normally when you inhale, it is an active process. It does require energy. But when you do a forced inhalation, like big breath in, this is happening when you are exercising vigorously. So I just got a Peloton. And at certain points when I'm riding on this bike, I feel like I can't breathe. I feel like I'm going to fall off the bike because it's just so hard to breathe. So that would be a forced inspiration. Other times would be when people have things like chronic obstructive pulmonary disease. We call that COPD. If you have an obstruction somewhere in the respiratory system, you can imagine that breathing in becomes very difficult. So your inhalation becomes very forced, right? You're really trying to get that air in. So during a forced inhalation, you are using not just the muscles I talked about during a regular inhalation, like your diaphragm and your intercostals, but you are also using muscles like your scalenes, sternocleidomastoid, pectoralis minor. These are muscles that you find in the neck and you find in the chest. So all anterior, okay? And if you just hold your neck and do a forced inhalation really hard, you can feel those muscles in your neck contract. So you can tell that those are being used in that process. These muscles are going to just help to pull that thoracic cavity open even more to allow for that forced inhalation. And it's going to allow your lungs to expand more. So again, that means that the volume is going up even more. So the pressure is going down even more. And that's going to drive air in faster. So now I want to walk you through expiration. So when you blow out, quiet expiration, just blowing out, is a passive process, meaning no energy is required. All of those inspiratory muscles that we talked about, like the diaphragm and their intercostal muscles, these are going to relax. And the volume in the thoracic cavity is now going to go down. So think of your diaphragm. Your diaphragm, when it contracts, it actually pushes down. So when it relaxes, it bubbles back up. So that means the volume in the thoracic cavity goes down. It gets smaller, right? And we know what happens when volume goes down. What happens to pressure? It goes up. It goes in the opposite direction. So that means that the pressure in the thoracic cavity goes up, right? You're kind of squeezing on those lungs. Pressure goes up. And that means that the pressure inside the lungs becomes greater than atmosphere, right? We write that as a positive number. That means it's 1 over atmosphere. And air is always going to go from a high to a low pressure. So in this case, it's going to go from where it's higher inside your lungs to where it's lower outside the lungs. Okay, so you are going to blow out. Air will flow out of the lungs down a pressure gradient. Now, we talked about a forced inhalation. So I also want to talk about a forced expiration. When you on purpose blow out really hard, that is an active process. That's actually using a lot of extra muscles. When you blow out hard, you're going to be using a lot of abdominal muscles, your oblique and your transverse abdominis. You're also using internal intercostal muscles as well. So this is why, like, when you laugh really hard, when you're laughing, you are forcing air out. You ever laugh so hard that you're like, oh, make me stop making me laugh. You're making my stomach hurt. That's why. It's because when you are forcing the air out, it is using additional muscles. Okay. So a forced expiration is not a passive process. It is an active process. So this is showing you here, if we look at this top graph, this is pressure in the lungs relative to atmospheric pressure. So this is like the intrapulmonary pressure in the lungs. And so again, remember, if it's at atmosphere, it's 0. And so this is showing you what's happening with the pressure inside your lungs during inspiration. Okay, you can see that the pressure dips below atmosphere. Okay, so the pressure in the lungs is under atmosphere. Air goes from a high to a low pressure. You breathe in. Okay, but also remember, I told you that it will eventually get back to 0, and you can see that right there. When you are expiring, when you're blowing out, the pressure in your lungs goes up, right? Everything's relaxing. It's squeezing back on the lungs. Pressure goes above atmosphere. Air goes from high in the lungs to lower out in the atmosphere. So you blow out. It also will eventually get back to atmosphere and equal 0. So where it's getting back to atmosphere is that quiet point in your breathing, where you're not breathing in, you're not inhaling, you're not exhaling. It's that pause between the two. That's when you have equaled atmosphere. Okay, so it's happening with at the end of every inhale, at the end of every exhale. Okay. Now the bottom line in gray up here, this is showing you the pressure that's in this pleural cavity, right? That space outside of the lungs. Now remember, one of the things we talked about in the last lecture is how the pleural cavity always has a negative pressure. It's negative to what's in the lungs and it's negative to atmosphere. It has to be so that it holds your lungs open. And so you can see that gray line down here. You can see that it's still going to kind of follow inhalation and exhalation, but notice it is a lot lower than what the pressure is in the lungs. It is negative. It's always negative. Now, there are a couple of factors that will influence pulmonary ventilation. And this is basically just how easy it is to get air into and out of the lungs, the energy required for you to breathe in and out. The first one is airway resistance. Okay, the term resistance just means anything that's blocking the flow. Okay, so airway resistance is anything that's going to block the flow or obstruct the flow of air into and out of the lungs. So any kind of condition that maybe narrows the passageways, that could cause an increase in airway resistance. And if it's harder for you to get the air in and out, if you increase resistance, that means you've got to put in more energy to breathe in and out. It's going to require a lot more energy. Other factors that can influence the energy required for breathing in and out: surface tension within the alveoli. Now, this is one that we talked about in the last lecture. So remember, we talked about how in the alveoli, you have type 2 alveolar cells that release surfactant. And surfactant helps to cut down the surface tension of water so that your alveoli stay open. They don't get pulled shut. And so it's preventing the collapse of the alveoli. Well, if you decrease that surface tension and your alveoli can stay open, then you decrease the amount of energy you need in order to breathe in and out. It makes it a lot easier to inhale, right? Because if your surface tension is really high, like in a premature baby, where they don't have enough surfactant and the water surface tension stays high, every time they exhale, the alveoli collapse. So an inhale requires a lot more energy to inflate them again, okay? So if you decrease surface tension, you decrease energy. And then the very last one is lung compliance. Lung compliance is how stretchy your lungs are, how much you're able to expand the thoracic cavity. And if your lungs are stretchy, if you can expand the thoracic cavity really well, that's going to decrease the amount of energy that you need to put into breathing. Okay. So I'm going to show you some pictures of each of these and talk about each of these in a little more detail. So the very first one I mentioned was airway resistance. So again, this is anything that's obstructing airflow into your lungs. As resistance goes up, your breathing movements become much more strenuous. To inhale, you're going to use a lot of extra intercostal muscles and accessory muscles, like the muscles in the neck and the pectoralis minor and major muscles. Anytime you have a severe constriction or obstruction in the bronchioles, this can prevent you from getting enough oxygen down into your lungs. And this can happen during asthma attacks, and it can stop you from being able to inhale, okay? And so this is why people, when they have asthmatic attacks, they might take things like epinephrine, like an inhaler. This just helps to dilate the bronchioles, get them open a little bit wider. A wider bronchiole means you're decreasing the resistance. You're making it easier for the air to get in. So it makes breathing a little bit easier. So this is a great visual image. So this is showing you a bronchiole, an asthmatic bronchiole. You can see that it has constricted, and you can also see that yellow mucus in there. So now not only has the bronchiole constricted, but now we've got extra mucus within that bronchiole. So you can see the airway is actually really, really tiny. So resistance is really high up here. I'll just write R with an up arrow, high resistance. A normal bronchiole is shown at the bottom, and you can see how wide open that airway is, very little mucus down in those bronchioles. And you can see in this case, the resistance would be nice and low. So much easier to breathe when the resistance is low. The second one that I mentioned that influences the amount of energy put into inspiring is the surface tension of the alveoli. So again, this is where that surfactant, those type 2 alveolar cells come into play. Remember, they release surfactant, which decreases the surface tension. So usually we only find this in premature infants where they're not making enough surfactant. The surface tension in the alveoli is really high, and the alveoli collapse after every breath. And so you can see that image over here on the right. You can see those alveoli collapsing. They're not staying nice and inflated. We call this infant respiratory distress syndrome. So that's also going to require a lot more energy. So after every exhale, when an infant starts an inhale again, they have to put in a lot more energy into that inhale to reinflate that bronchial tree. And then the last one that I mentioned that influences energy when you're breathing in is lung compliance. This is how stretchy the lungs are, how nice and big the thoracic cavity can get when you breathe in. Things that can decrease lung compliance and make it not as stretchy would be things like deformities of the thorax. Let me show you some pictures of that. So you can see this top image up here. This is sunken chest. So you can see the sternum here and the way that the ribs have formed. The sternum is sunken in. That's going to decrease the amount of space for the lungs, and it's going to make it so that it's not nearly as stretchy. That thoracic cavity cannot expand as much. Okay. There is a swimmer, an Olympic swimmer, Ryan Lochte. I think that's who it was. Does that sound familiar? Yeah. He had this condition when he was little. And so his doctor said the best thing for him, they can do surgery, but the doctor said the best thing is to actually build up the chest muscles. And that can help to pull that open a little bit more. And he said swimming was one of the best things that he could do as a young kid. And that's how he actually got into swimming. Okay. Other deformities of the thorax, you can see them in these images here as well. Things like scoliosis. Now, I know that this is a lateral curve of the spine, okay? But when you look here, you can see on this side, there's obviously going to be deformities in the rib cage as well when someone has scoliosis. So a lot of times when they go in to correct scoliosis, they'll put rods down the spinous processes of the vertebrae in the back, straighten it out. They usually will also have to break ribs and reconnect them as well. Okay. And that's going to help increase thoracic cavity and lung compliance. Other things would be like ossification of costal cartilage. If costal cartilage, remember, this is all the cartilage up in here that connects the ribs to the sternum. If that cartilage either calcifies and gets hard, or if it gets turned into bone and ossifies, that means that your ribs can no longer pivot up when you breathe in. That means that you're decreasing your lung compliance. That thoracic cavity is not going to be able to stretch as much. And then the last one is if your intercostal muscles are paralyzed, then you're not going to have as much lung compliance. An example of that might be someone who has a spinal cord injury in the cervical region. A spinal cord injury in the cervical region causes someone to be quadriplegic, can't move their arms, can't move their legs. But it's also basically paralyzing everything from that injury site down. So that means that all those intercostal muscles are paralyzed. Now, the diaphragm's not paralyzed. If y'all remember from Anatomy 1, the diaphragm is actually controlled by a nerve that comes off the brain called the phrenic nerve. Okay, so that one's not going to be, not off the brain, but it comes way off at the top of the spinal cord. So that one's not going to be paralyzed. So they can still breathe in and out, but a lot of times the lung compliance is way down. So this is why a lot of times when people are quadriplegic, they may need a little assistance with breathing. So like Christopher Reeves, you know, when he was in the wheelchair, he had to have some extra assistance with breathing. Okay.